This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from Neurology India, published in 2026, titled Effect of Pharmacological Neuroprotection During Surgical Clipping of Anterior Circulation Intracranial Aneurysm on Neurological Outcome, a randomized controlled study.
This is a topic that hits home for anyone who has spent time under the microscope. We're talking about that high-stakes moment in the OR when we have to apply a temporary clip. Alara, why is this specific moment so critical in the context of this study?
Well, as the paper highlights, when we are performing neurosurgical clipping for intracranial aneurysms, we frequently require the use of a temporary clip on the parent vessel to facilitate a safe dissection or to manage a rupture. However, that maneuver inherently involves the risk of cerebral ischemia. This study specifically looked at anterior circulation aneurysms and how we can best mitigate that risk.
Right. And the paper outlines two usual approaches for preventing these adverse ischemic events. One is more reactive and one is more preemptive.
Exactly. The first approach mentioned is detecting ischemia using somatosensory evoked potentials, or SSEP, of the relevant arterial territorial distribution. If the SSEP drops, the surgeon takes corrective measures. The second approach, which is the focus of this randomized study, is the use of preemptive pharmacological neuroprotection.
And for our residents listening, when the paper refers to pharmacological neuroprotection in this context, it's specifically talking about using agents to induce burst suppression on the EEG before the temporary clip is even applied.
That's a key distinction. This study wasn't just looking at neuroprotection in general, it was studying the effect of preemptive pharmacological neuroprotection on postoperative neurological deficits and the overall outcome for these patients.
Let's dive deeper into that territorial distribution aspect you mentioned. In anterior circulation surgery, say an ACOM or an MCA aneurysm, why is the SSEP monitoring so specific?
The paper emphasizes that SSEP monitoring must be focused on the relevant arterial territorial distribution. If we are clipping the ICA or the MCA, we are looking for changes in the somatosensory pathways that correspond to those specific vessels. The study contrasts this with the preemptive pharmacological approach, where we aren't waiting for a signal change. We are pharmacologically lowering the metabolic demand of the brain to a state of burst suppression before the ischemia even occurs.
It's a classic debate in the field. Do we wait for the SSEP to tell us there is a problem and then take corrective measures, which usually means removing the temporary clip or raising the blood pressure, or do we protect the brain ahead of time? Alara, what did the study's design look like?
It was a randomized controlled study, which is the gold standard. They looked specifically at anterior circulation intracranial aneurysm surgery. They were measuring two primary things: postoperative neurological deficit and the overall neurological outcome.
This is important because in the OR, we often see patients who look great on the table, but the true test is that postoperative neurological exam. A temporary clip that stays on a few minutes too long can be the difference between a patient walking out of the hospital or needing long-term rehab.
Precisely. And by focusing on preemptive neuroprotection, the researchers are asking if inducing that burst suppression state, essentially putting the brain in a standby mode, actually reduces those postoperative deficits compared to our standard reactive protocols.
It's interesting that the paper groups the SSEP-guided corrective measures as a standard approach. For medical students listening, SSEP gives us real-time feedback on the functional integrity of the sensory pathways. If the relevant arterial territorial SSEP signal dampens, it's a warning shot. But this study is pushing the envelope by looking at whether the pharmacological route, performed preemptively, provides a superior safety net.
And because it's a randomized study in Neurology India, it adds some much-needed data to our protocols for anterior circulation aneurysms. We're often balancing the side effects of neuroprotective drugs, like hypotension, against the benefit of ischemia protection.
That's the crux of it. The study aims to clarify if that trade-off leads to a better neurological outcome.
Ultimately, the goal is to make the use of a temporary clip a safe necessity rather than a high-risk gamble.
Absolutely. A very focused study with significant implications for our daily practice in the vascular suite. Thanks for breaking that down, Dr. Alara.
Thank you, Dr. Aris. We hope this gives our listeners some food for thought for their next aneurysm case.
We'll see you in the next episode of the Neurosurgery Hub podcast.